Looking back over the years of research into the impact of the Troubles on the community, it's now very clear that we didn't actually understand very well in the early years of the Troubles what the impact was. When various researchers were beginning to identify very marked levels of psychological problems in the community, and particularly amongst those who had been directly exposed to acts of violence. If we'd had that information earlier in the history of the Troubles, we would have been able to do things a lot differently. I was involved in managing services following both the Enniskillen and the Omagh bombings. And one of the things we looked at very closely in the response to the Omagh bombing was the impact on health and social care staff. And that obviously involved social work staff as well. And it was very clear that those staff who had been directly involved in responding to the bombing had psychological consequences which were approximate to those who were witnesses on the street in Omagh when the bomb exploded. For example, doctors and nurses and other staff working in the hospital, people working in the leisure centre, which was used to try and identify those who are missing and subsequently to identify the dead. These had major impacts on health and social care staff. So there were these very direct effects going on, as well as this wider community anxiety about the violence.
Somebody starting out now, I think I would want them to be much better equipped personally in terms of really understanding the realities of the job. And nowadays we recognise there's another component. There's what we as individuals bring to the dynamic. And that I think we've got a lot better at because people like me didn't have it. And that's what I'm trying to get my students to understand.
Things have moved on a lot and thankfully it is safer, but it has still left a big legacy that will be with us for years to come. You need good support systems because if you don't have those, it leads to compassion fatigue and eventually burnout. What I would like out of this would be to ensure that there are good supervision, peer support and an acknowledgement of the complex environment social workers are operating in.
Through social work, we've been able to help people to live during those troubles and more importantly, deal with the aftermath and the impact of the troubles. We can apply some of those practices and techniques now and have better outcomes than we even did in terms of for the troubles. Because for me, social work was the catalyst of change during the troubles by building a network and a framework of structures around them and around their communities.
I think looking back on it, there undoubtedly was an impact. There was a challenge then in having to engage with people in that more neutral fashion when actually some of the issues we were engaging with had the potential to raise a lot of distress or a lot of questions or querying. If there are lessons to be learned or experience that is worth giving to others, then that's an important thing to do as well.
We're increasingly recognizing how the long-term impact of trauma on individuals, on families, the intergenerational impact of trauma. And I think social workers now need to realize that they may be working with people and the origins of the issue they're encountering may be in the past.
I think it's important that we continue to learn from the evidence of the impact of the Troubles. The danger is that as the world moves on, as new generations come along, as new political issues preoccupy us, the long-term consequences of the Troubles are forgotten about. My concern is that the impact of the Troubles, particularly from a mental health and social and family point of view, were not given the level of visibility within the peacemaking process that, say, was policing, the release of prisoners, and a number of other areas. And really, the mental health of our population is critical to the long-term well-being of our community. Even though it's late, we need to be still working hard at this, making ourselves available in such a way to the public that reflects the needs of the public and not in some kind of sterile, remote way.